Looking to grow your medical practice in a difficult time? Well, the Practice Value Creation Guide is here and it can help you with your medical practice. Here's how. We spent a lot of time creating this Practice Value Creator Guide, and it's really about helping you understand what the next level looks like for your medical practice. You've been struggling. We've talked to hundreds of medical practices across the country, and we hear the same stories over and over again. Wow, it's tough since the pandemic to stay in practice. It's been difficult to deal with the inflation with the rising cost of everything. Things like shrinkflation, which is about the cost of things getting more and more expensive for something you would have paid, whereas what you bought previously was not the same size. Typically, it's about buying something that you were used to buying a certain quantity, but now you're paying the same price for something of a less quantity. And this is really affecting a lot of medical practices and organizations. So shrinkflation, inflation, also dealing with recent hacks we saw with Change Healthcare. There's been an interesting thing that happened where tons of medical patient data just disappeared due to a hack. And this is affecting a lot of individuals trying to get medical billing up and running. So we're seeing this more and more with healthcare organizations just screaming to the heavens, figuring out like, what can they do to be successful? Well, this practice value guide is really built with that experience in mind. We really thought about like, what are some ways to help medical practice quickly, typically in the next 60 days, so they can get on the right path to success and stay viable in the communities where they are. Because in our opinion, medical practice organizations that get bought out by larger groups, it just doesn't help them. It doesn't help the community. It doesn't help the patients that need them. And ultimately, the patient and the doctor communication, that relationship is sacred. And we have to maintain it at all costs. And a lot of independent physician groups and organizations, they help with that piece of it. So what does that look like for us? This is the perfect time to get prepared for it. Why? Because of all these different changes. If you know what you're faced against, then you can find opportunities. Don't be overcome by the swell of information that's coming that's negative. There's a ton of opportunities for medical practices like yourself to grow and to achieve more. One of the things that we're seeing is that a lot of medical practices don't realize there are hidden things that they can do today that can help short revenue. One of the things is medical billing. Deep dive into what's going on with your medical billing now and figuring out how can we get compensated better. For instance, are they billing in time? Are you looking at your accounts receivables every 30 days and determine if what you got paid and what you said your medical biller said you were going to get paid, do they match? They should. And that's what thing that you can do to start ensuring that you're getting compensated fairly. And at the same time, more importantly, looking at anything that got missed. So if you constantly seeing bills and you're seeing missed payments, then you need to make sure your biller is doing it correctly, ensure you get reimbursed as you should, and doing and taking care of denials. Medical billing is key, but also you could be missing out on millions of dollars just helping with staffing issues. If you have mid-levels or individuals that come in to help you with your organization, you could be running into tons of issues where you're having constant turnover. One mid-level, one front office staff or billing staff member can affect you with hundreds of thousands of dollars of costs from retraining, rehiring, and placement of that individual in your organization. So how do you prevent that? Having a good system in place is key. Making sure you hire correctly and make sure you tie that into how does that affect your culture and what's your culture for the future. So when that mid-level comes in, they know what to expect and that culture guides them to do better. Ultimately, you also need to have incentives to ensure that individual wants to stay a part of that organization, and that can contribute to a lot of lost revenue. One of the other things you can do is creating standard operating procedures, which are simple tasks, things that are written out, workflows that adhere to your medical practice and how you do things so that everyone is trained to it. One simple hack, go ahead and record those trainings, making sure that the staff understands what they need to be prepared for and they do it by watching the video, understanding clearly what the areas they need to invest in themselves from that training session. One of the other things as you prepare to move on is understanding new trends and new ways that you can grow revenue. If you're looking at revenue opportunities, there's tons of different ways. If you're doing the old way, fee for service, now's the time to open your eyes to value-based care programs. If you started dabbling them with annual wellness programs, look at other ones that are out there like behavioral integration, remote patient monitoring, chronic care management, and there are new codes all the time. As a matter of fact, as of this recording, this year they released 4 new codes that help patients with navigating complex illnesses or helping you bring in caregivers to help be an extension of you to the patient. A lot of these things are happening now, and you have to be aware of how you can be prepared for the future of growth for your medical practice. One of the things you need to also look at is vendor selection. How are you selecting your vendors? Listening to your colleagues is important to understand how they're selecting vendors, but you need to have a process in place to ensure you have the right vendors who not only believe in the culture that you believe in, also have the right pricing, but also understand how best to work in your workflow. A lot of times pricing is the only thing that a lot of medical groups and medical practices look at, but that should not be it. If it's tied to your longer growth projections, which is tying to future growth like value-based care, understanding how that vendor matches into where you want to go is really the important thing to understand as you build out for that pathway. Do not let price be the only valuation, because sometimes price can be misleading. There's a saying, you pay for it either up front or you pay for it later. If you don't get the right vendor in place right away, you will pay for it later when you have to uproot everything, get a new vendor, and then pay for it again. And a lot of times with business, you struggle. We understand that as well, from the short term and the long term. Typically, the long term is probably the most important, but the short term is urgent. How do you balance that in your business and understanding how to do that? And that's some of the things to understand and get that standpoint. One of the things also we try to impact in you in this pocket guide is really the mindset that goes into this. If you look at how you get to the next level, anything, and how you progress, you have to look at it as a ladder. The first level and base level is tools. Just understanding what software you need, what EMR systems. That's a simple test. That's something that you can get and train individuals to do at that test level. The next higher level is skills. Understanding how to use the tools to get it to do what you want to do. For instance, if you have an EMR, you want to be able to send automatic messaging to the patients, then guess what? You need to have the skill to set that up properly. And that's also training, but it can be advanced, right? Because there's different ways to set it up. You have to think through the process more effectively, and you have to understand your patients, how best they want to be communicated. Do they want to communicate via postcard, or do they want to communicate via email or text? So that's a skill of understanding that. And that can be developed a little bit longer, but it can be developed because pattern recognition, human beings are very well versed in that and how to do that. And having pattern recognition will get you to the next level. But the ultimate level is the mindset. The mindset is really the ultimate goal to make all the ones work better. If you do not have a clear sense of where you want to go with your business, then the rest of the tools and the skills will mean nothing. You have to have a clear vision. You have to understand who's with you in that vision so you can go further. You want to go fast, go alone. If you want to go far, go together. So you want to make sure you have the right partners with you as you go further with this mindset, and then you can make the investments in the skills and the tool sets to get you where you need to go. And that's really what this pocket guide is about, understanding how you can put this all together and think through it more clearly and succinctly as you build out for the future, because ultimately it's about understanding where you need to take yourself and prepare for this new change in healthcare. Go check it out. Let us know what you think. Hopefully this insight into what we've written can help you understand more about what's possible. When you think about it, there is a lot that's possible in your practice. You just have to implement it and do it right. Again, there's a guide. If you want to check it out, it's there in the comments, it's there in the description section. Ultimately, we want to make sure these videos are impactful and helping you now as you're building out your medical practice. So if you like this content, go check out some of our content where we talk about value-based care programs, how to build out new programs around clinical studies. These videos will be placed next to you and be recommended shortly, but definitely we want to make sure you are prepared for the new normal of healthcare.